Good afternoon, class and Brad. Today I'm going to be doing my presentation on Aboriginal and Torres Strait Islanders in geographic isolation, particularly focusing on remote communities. Now, if I was in the class, I'd probably do a little activity and do a brainstorm together, considering some of the issues that may impact the Aboriginal and Torres Strait Islanders in these areas. So a few detrimental ones that I could think of would be health and possibly education and employment. So first we're going to look at what is geographic isolation. Geographic isolation means the separation and distance between an individual and a metropolitan area. Now, a metropolitan area is any area that is built up, so like a city or a town, like areas that we might live in. Around 7 million people, or 29% of the population, live in rural or remote areas. First, we're going to look at a definition of rural. These areas are generally located outside of the towns and cities and have a low population density and small settlements. When we look at remote, these areas are very far in distance from urban areas. They're an isolated community, and they are out of the way considerably from civilization. Advantages and disadvantages. It's important to acknowledge that the people living in these remote areas does not necessarily mean that they are disadvantaged. Of course, in some instances they may be disadvantaged. However, this may be reliant on many various factors, such as the impact these individuals' quality of life and livelihood. I've got a quote here. It says, despite poorer health outcomes for some, the household income and labour dynamics in Australia's survey found that Australians living in small towns of fewer than 1,000 people and non-urban areas generally experienced higher levels of satisfaction than those living in major cities. So that says that these Indigenous people, like a percentage of these Indigenous people, enjoy living in these remote areas and they don't consider it a disadvantage. So I've got a graph here that just shows, this was a study done in 2011, and it shows the greater proportion of Aboriginal and Torres Strait Islander people geographically distributed than non-Indigenous Australians. So as you can see, in major cities, Indigenous are 35% compared to non-Indigenous 71%. And in very remote areas, there's 14% Indigenous compared to 0.5% non-Indigenous. So there's not even 1% of people living in very remote communities of the non-Indigenous community. Alright, so this is a list of challenges like I was brainstorming before. So those Australians that live in these areas that are geographically isolated face unique challenges. Some of these are poor health, poor welfare outcomes, disadvantage in education, disadvantage in employment, minimal income and access to services. These are just a few, there could be many more listed, but we don't have time to go through them. Right, here's another graph. It shows health. People in remote areas of Australia suffer higher levels of health risk factors compared to those living in metropolitan areas. Remote areas recorded higher rates of daily smoking, excessive alcohol consumption, physical inactivity, obesity and weight. So as you can see, the current daily smoker in major cities is 13% compared to 22% in remote. Overweight or obese is 61 compared to 68 in remote. No or low exercise 64 compared to 72 in remote. And like alcohol consumption is 16% in cities compared to 24% in remote. So as you can see, all of the percentages in the remote area were higher for those health risks. Alright, so death by injury, car accident, asthma, diabetes and infant mortality are notably higher in these remote communities than metropolitan areas. Data shows that males and females that live in these remote areas are hospitalised twice as often for diabetes than those living in metropolitan areas. One of the girls did her presentation on health and diabetes, and she showed the higher percentages that were hospitalised for these people with diabetes type 1 and type 2 in the remote communities. Deaths related to asthma are also similarly higher in these areas, and suicides have remained constant over the past 100 years. However, continually show higher rates in these remote communities also. Alright, I've got another two tables here. Shown in this table above is the average age of death dependent on remoteness that could have been potentially avoided if individuals had the proper individualized care or hospital care. So as you can see, in the major cities there was far less deaths as they received the right care, and in the very remote areas there was more deaths as they couldn't get the right individualized or hospitalized care. And it says that people living in very remote areas have a death rate 2.5 times higher than major cities. This graph here shows the median age at death. In major cities is 82, and in very remote areas is 67. Now that's a huge difference. Living and working conditions that make up our social environment influence our health and well-being. Generally, the higher a person's socio-economic position, the better their quality of life. Low socio-economic status is a disadvantage in terms of health, as it significantly increases social detriments and health risk factors. Some of these may be lower levels of income, employment, and education, higher occupational risks, and geography, the need for more long-distance travel in order to access fresh foods and access to health and services. Looking at employment and income. Employment rates decrease with remoteness. Some reasons of this would be according to illness, disability, and lack of market opportunities. Like, as you can imagine, there's far less job opportunities in a very remote community than in a metropolitan area. Levels of income are also generally decline with geographic remoteness. So I've got a statistic here that says the average income of an Indigenous in 2006 was 69% of the corresponding income of a non-Indigenous. However, this declined to approximately 40% in remote areas. So they were already earning less than the non-Indigenous within the metropolitan areas, but when you went remotely, it went far less, down to 40%. The Community Development Employment Project scheme enables Indigenous community or organisations to pool the unemployment benefit for those individuals who choose to participate in the employment in various community developments and receive individual income support rather than receiving individual income support payments. So saying that if they help in the community or participate in some sort of organisations and they pull the funds from that instead of receiving like the dole or Centrelink benefits. Education. Higher levels of schooling have been linked to improved health outcomes. Geographically isolated students attend funded schools. Children often have to travel long distances for extended periods. There is a struggle to keep these schools staffed, as their short-term contracts may be a concern. There is rapid turnover in staff, and teachers may not have had any teaching experience. However, this may not be a disadvantage, as they could bring new and exciting creativities into their teaching. Most schools offer incentives in order to keep their staff interested. For many widely spread individuals, distance education provisions are available in each state. Housing. The issue of home ownership in remote communities is subject to availability of house purchasing stock, affordability, and regular employment or income. Data shows that Indigenous Australians living in remote communities required at least one additional bedroom, as high levels of poor housing quality are found in these extreme isolation areas. Poorer quality dwellings result in poorer well-being, lower levels of family functioning, and more life stresses. These factors may also result in substance abuse. The next one is services. So Indigenous people in remote areas have limited access to services such as health, education, aged care, law enforcement, transportation, and support. They may also face problems such as language barriers, lack of cultural awareness and cultural isolation. Other issues that arise when requiring a service are delayed response time, longer waits, higher cost, affordability, and lack of culturally appropriate services. When we look at the criminal justice system, Indigenous women are 23 times more likely to be imprisoned than non-Indigenous women, and Indigenous men are 16% times more likely to be imprisoned than non-Indigenous men. Data collection on Indigenous prisoner health is relatively poorer than non-Indigenous people. There are many deaths after these people have been imprisoned related to behavioural disorders and drug-related deaths. Children who seem to be in need of protection may be in contact with community service departments and child protection agencies through the expression of concerns or reports. Rates of Indigenous children entering the Child Protection Service are higher than non-Indigenous children. Alright, now we're going to look at innovations in educational support, teaching and community development. I just want to make a statement saying that these remote communities of fewer than 1,000 people are supported by more than 80 programs and services, so they're not lacking any support. They've got so much available to them, it's just up to whether they want to take advantage of what's available to them or not. Alright, when we look at health, we look at social support may come from a variety of sources such as family, friends, workmates, doctors, or community organisations. Social support may be emotional, esteem support, tangible assistance, information, and network support. There is specialist outreach in these remote areas that can improve early intervention and the coordination of care, as well as reducing hospitalisations. The Royal Flying Doctor Service is available 24 hours to these remote communities. There are culturally tailored programs that show awareness, prevention, and early intervention for mental health, well-being, and suicide prevention. The National Strategic Framework is designed to integrate with existing policies and planning to provide a much-needed focus on specific issues and solutions relevant in remote health. And the last one says that the National Health Reform aims to ensure Australia's health system can meet increasing demands and take advantage of improvements and innovations in medical and other technologies. Innovations for education. Australia offers scholarships and allowances to students in rural or remote locations who live away from home and attend school. So there is a living away from home allowance, there's a boarding scholarship for isolated students, and there's assistance for isolated children's scheme. So this is an Australian government program that targets students that can't attend their schools because they're geographically isolated. They have disabilities or special needs. Distance and Rural Technologies Team, which is the acronym, the DARP is the acronym, assists students and schools with technologies to improve rural and distance education. It operates as a satellite service for remote communities. This can be used, so because it's operated by a satellite service, it can be used where broadband is not an option, like where they don't have internet. It allows for isolated students to participate in distance education. Some things that are available to them are like virtual excursions, educational experiences which use video conferences and allows them to engage with experts that are across the globe. Some programs that aren't available to kids but are available to the communities and teachers that offer support and development are the Rural and Remote Network Initiative, which provides these rural schools the opportunity to develop innovative curriculum programs for their students. The Rural and Remote Prep to 12 Careers Education Initiative. So this is a program that assists schools in embedding careers educations into the curriculum. And the Rural and Remote Marketing Program. So this provides HSC teachers with the opportunity to mark the HSC papers. This provides them professional learning opportunity. And the last one is Rural Experience provides an opportunity for permanent teachers to take part in a short-term placement of 1 to 4 terms. Closing the gap. So it's hard to ensure that all issues have been addressed, as there are still gaps in the availability and coverage of data in these rural and remote areas. The Closing the Gap strategy in the National Indigenous Reform Agreement set targets to close the life expectancy gap within a generation, halve the gap in mortality rates for Indigenous children within a decade, ensure access to early childhood education for Indigenous in remote communities within 5 years, halve the gap in reading, writing and numeracy achievement for Indigenous within a decade, and halve the gap in reading, writing, halve the gap for Indigenous students in Year 12 for finishing school, and halving the gap in employment outcomes between Indigenous and non-Indigenous Australians within a decade. Thank you for listening to my presentation today. I hope it gives you a bit of an insight and understanding into what the Aboriginal and Torres Strait Islanders have to deal with living in these remote communities.